Hello everyone and welcome back to Pain School. Today we will be discussing anti-inflammatory nutrition. We'd like to thank Laura Lee Harwood, one of our registered dietitians here at the Cole-Marie O'Neill VA in Topeka, Kansas, for providing this presentation today. So some objectives that we will go over today include that we will be able to understand inflammation as it relates to health, to understand the relationship between dietary intake and systemic inflammation, to identify specific dietary components that can increase inflammation as well as decrease inflammation in the body, and establish a SMART goal. So anti-inflammatory nutrition is thought to be beneficial in reducing inflammation associated with chronic diseases such as heart disease, cancer, Alzheimer's, and arthritis. It's also thought to reduce pain associated with inflammation, as well as reduce weight, which can be a component in chronic diseases such as heart disease and diabetes. It can also help better manage chronic diseases proactively with food or nutrition. So first, a little science. There are two forms of inflammation in our bodies. Acute inflammation is a critical and important process within our body that allows our body to heal and repair itself. Chronic inflammation, however, can lead to tissue damage and increase morbidity and mortality. It's also the pathophysiological process for cardiovascular disease, type 2 diabetes, irritable bowel disease, periodontal disease, obesity, depression, arthritis, asthma, many cancers, and more. So what is the anti-inflammatory diet? The anti-inflammatory diet is a way of eating or an eating pattern. Some examples include the Mediterranean diet or the Asian diet, and it's associated with good health and longevity. The philosophy behind these anti-inflammatory diets is to increase anti-inflammatory foods and reduce foods that trigger inflammation. These diets are built on evidence-based research that dietary components found in certain foods can play an important role in mitigating chronic inflammatory processes associated with many chronic diseases. Taking a quick look at our food pyramid, we can see that at the top of our pyramid includes healthy sweets, red wine, teas, and some herbs that should be used in smaller amounts daily and throughout the week. In the middle of our pyramid includes most of our proteins and omega-3 fatty acids. At the bottom of our food pyramid includes the foods that we should be incorporating the most in our diet, such as vegetables, fruits, and whole grains. So which foods cause inflammation? Simple sugars are a big one that cause inflammation. These are high glycemic load foods, so having lots of glycemic load or lots of sugar that results in rapid rise and fall of insulin levels that can then cause inflammation. Also, saturated and trans fats can also cause inflammation within our bodies. Anti-inflammatory foods include omega-3 fats, which many of our fish have, such as salmon, sardines, herring, mackerel, many of our oils, leafy green vegetables, and walnuts. Also yellow, orange, red, and dark leafy greens, citrus fruits, green and black tea, and herbs such as cinnamon, ginger, and turmeric. So how do we start doing the anti-inflammatory diet? Well, whole grains should be used half of the time. Healthy fats should be incorporated into the diet with 2 servings at least weekly. Often this can be incorporated by eating fatty fish such as the salmon. Drinking plenty of water, which can also include green tea. spicing up food with some of those spices and herbs that we discussed earlier, and enjoying some dark chocolate sparingly. This dark chocolate should be 70% minimum cocoa content, and most of all, incorporating a variety of vegetables and fruits, ideally 8 to 10 servings per day. Taking a closer look at our carbohydrates, ideally we should be consuming 4 to 6 servings per day of whole grains. This includes our wheat, oats, barley, and more. Evidence has shown that people who eat at least 3 daily servings of whole grains have been shown to reduce their risk of heart disease by 25 to 36% and reduce the risk of stroke by 37%. There is also some reduction seen in the chance of getting type 2 diabetes, digestive system cancers, and hormone-related cancers. Many of our carbohydrates with whole grains also support B vitamins, vitamin E, magnesium, iron, and fiber intake as well. To take a closer look at our fiber, we can see that there's 2 kinds of fiber: soluble fiber and insoluble fiber. Soluble fiber binds with cholesterol and helps move it through our digestive tract. This can help with lowering LDL, or that bad cholesterol, and therefore lowering the risk of heart disease. It also helps with digestion and allows for sugar to be absorbed more slowly, which helps with blood sugar control. Insoluble fiber adds bulk and helps move food through our intestines. This can help with faster and easier relief of constipation. Ideally, for daily intake, men should have 38 grams per day of fiber, and women should have 25 grams per day of fiber. Looking at healthy fats, we have monounsaturated fats and polyunsaturated fats, or omega-3 fatty acids. Monounsaturated fats include many of our oils, such as olive, canola, and peanut oil, which also contribute to vitamin E and antioxidants. Our polyunsaturated, or omega-3 fatty acids, can also be found in many of our leafy greens and oils in the form of alpha-linoleic acid. Alpha-linoleic acid is converted in our body to EPA or DHA, other forms of these omega-3 fatty acids. However, it's often not enough. Therefore, it's really important to have omega-3 fatty acids in our diet as well, which can be found in those fish discussed earlier, such as salmon, tuna, herring, sardines, halibut, and mackerel. Research has shown that 1 to 2 servings per week of these healthy fats may reduce the risk of coronary death by 36%. These healthy fats can decrease triglycerides, decrease inflammation, and decrease LDL, which is the bad cholesterol in our bodies. It's also really important to incorporate enough protein in our diets. That's because protein is the building block for many processes in our body, including healthy bones, muscles, cartilage, skin, blood, and also many of our enzymes, hormones, and vitamins. Many of our proteins also contribute to iron levels, which help carry oxygen through the body, magnesium, which releases energy from muscles and helps nerve function, zinc, which is necessary for biochemical reactions and supports immune system, and vitamin E, which is an antioxidant used to protect tissues from damage. Protein should be obtained through many different foods, including legumes, or such as our kidney and pinto beans, whole grains, nuts, and soy, fish, milk, ideally fat-free or low-fat, and to determine how much protein you need, the general guideline is 0.8 grams per kilogram. Next, we'll discuss drinks, spices, and sweets that can have antioxidants. First is green or black tea. These contain catechins. It's thought that these phytonutrients, the catechins, have as much antioxidant activity as 7 glasses of orange juice or 20 glasses of apple juice. Next is red wine. Red wine contains resveratrol, which is a phytonutrient that also acts as an antioxidant and anti-inflammatory, and it's found in red grapes, purple grape juice, and red wine. It is important to note, though, for red wine that women should have 1 glass maximum per day and men 2 glasses maximum per day, with each glass being about 5 ounces. Many spices are also known as having antioxidant properties. Some include ginger, turmeric, red and black pepper, licorice, clove, garlic, coriander, and cinnamon. Specifically, cinnamon has been shown to decrease glycemic response. Garlic has been shown to potentially help lower LDL, or that bad cholesterol, and lower blood pressure. Lastly, we have dark chocolate, which should be eaten sparingly, but may have antioxidant properties as well. It's also important to note that the dark chocolate should have a minimum cocoa content of 70%. Some other antioxidants are phytochemicals, or chemicals that are found in plants that also act as antioxidants. Include lutein, which is found in many green leafy vegetables and yellow vegetables like squash or mango. Selenium, which can be found in many of our mushrooms and beans, as well as some leafy green vegetables. Vitamin A, which is found in fish oil, milk, eggs, and many of our leafy green vegetables. Specifically, beta-carotene can be found in many orange and red fruits and vegetables, such as squash and carrots. Vitamin C, which can be found in our citrusy fruits, such as oranges, grapefruits, or pineapples. And vitamin E, which can also be found in many of our vegetable oils, nuts, and green leafy vegetables. Research has found that these phytochemicals act as antioxidants and have properties that have been shown to protect against chronic diseases. Here's a quick look at some of the fruits and vegetables sorted by their color and what they can do for our bodies if incorporated into our diets. Blue fruits like blueberries and grapes can decrease blood pressure, decrease liver injury due to toxins, and decrease cardiovascular risk. Red or purple fruits and vegetables like grapes, red apples, and berries can decrease the risk of prostate cancer. Red fruits and vegetables like tomatoes and watermelon can decrease the risk of prostate and GI cancers. Orange fruits and vegetables like carrots and squash are really good for eye health. These contain those beta-carotenes we discussed earlier. Orange and yellow fruits such as oranges, peaches, and papaya also have that carotenoid antioxidant. Spinach, greens, corns, and avocados, so those yellow and green vegetables and fruits, are also good for eye health and can decrease cataracts and macular degeneration. Green vegetables like broccoli, Brussels sprouts, cabbage, and kale can decrease cancer risk. And white or green vegetables such as garlic, onions, and celery can inhibit phospholipase A2, COX-1 and 2, and lipooxygenase, which can all contribute to inflammation. So lastly, let's talk about SMART goals and how we can set those. SMART goals are goals that should be attainable and specific. So an example of what would not be a SMART goal would be setting yourself up with a goal such as, I'm going to eat only vegetables every day for the rest of my life. That is a very difficult to attain goal, as well as very non-specific. A SMART goal would be a goal such as, over the next 2 weeks, I will eat 20 servings of vegetables. That would be a specific and attainable goal to make for yourself. Some other examples include Each week during the next month, I will try a new vegetable. I will consume a different color or X amount of different colors of produce each day over the next week. Or over the next week, I will add this vegetable to my different meals 3 times. So setting more specific goals can help make these goals more achievable. It's important to start with small steps instead of large steps and work your way up to those larger goals. In closing, what are our key things that we've learned today? The first is to incorporate a variety of vegetables and fruits in your diet, ideally 8 to 10 servings per day. Whole grains should also be incorporated at least half of the time. Ideally, 2 servings of fatty fish weekly or other forms of foods that can have those omega-3 or unsaturated fatty acids. Healthy fats in moderation, preferably unsaturated. Spicing up meals with some of those spices and herbs that have antioxidant properties such as garlic, ginger, turmeric, and cinnamon. Drinking plenty of water and also incorporating green tea daily, as well as some occasional glasses of red wine, no more than 1 to 2 daily. And then lastly, enjoying some dark chocolate sparingly, remembering that it should have at least 70% minimum cocoa content. If you're interested in any individual nutrition counseling, please reach out to your primary care provider and request a consult for an outpatient dietitian. Thank you so much for listening to this presentation.